And they're the same? So the one's just
Well,
bigger?
they're very similar. I'll try to go through it with you. Okay. So, I can't decide which is better. Is it better with the light or without the light? Almost looks like there's too much shine with the light.
Yeah.
I don't know.
Just the brightness.
Oh, that's asking for too much, Edison. I don't think so. I guess, I don't know. Well, whatever. Anyway, so this is your anterior surface of your sheet part. Okay? This is your anterior, that's the anterior surface of your sheet part. Remember, you can see that fat kind of going in a stripe across the side like that. That's your anterior interventricular sulcus. It contains a little groove. Inside of it is your anterior interventricular artery, one of your main coronary arteries. And there's fat over it, which makes it look like that. All right? In your cow heart, here it is there. All right? Same type of dealio. All right? Now, let's just take it, we'll try to take it from when the blood comes back to the heart to when it leaves the heart. So, sheep heart, got to go on the posterior surface here. Up here, I can find it, in there, okay? This hole on top and this hole on bottom, these parts represent the superior and the inferior vena cava. So up here, picture the superior vena cava coming off of there, picture the inferior vena cava coming off there. And so when they go inside the heart, what chamber are you going to be in?
Right.
The right atrium. Okay, so you're going to be inside the right atrium. Let's see if I can see that there. Let me split the heart apart. Okay. This is the posterior half. So you're going to be up inside there. Okay. My tip of my finger is inside the right atrium. You can see because there goes my finger out of the superior vena cava, and well, there. And there goes out the inferior vena cava. So I'm inside the right atrium now. Okay. As the right atrium comes down, you pass through this first valve here, which is the what? That's your tricuspid valve. Those little stripety-stripe things there are the chordae tendineae, and the little muscle they're attached to is the capillary muscles. Okay. So when the right ventricle contracts, these little valves, the tricuspid valve flips up towards the right atrium, but these guys hold it in place so that it doesn't flip all the way back in. And these valve, the tricuspid valve stops blood from flowing back into the right atrium. Okay? Now, coming off of the right ventricle, you then go through what valve? Right ventricle goes to the pulmonary valve, which takes you into the pulmonary trunk. Okay?
Yeah.
We now have to switch to our anterior specimen, okay, and look at it. So now we're dealing with what we've got over here. Okay? This is your right atrium coming up, and if you follow your finger, I don't know if my finger's long enough, and I don't know if this is narrow enough, this should go through and out. I'm wearing it like a ring. Flip it over. I'm going out through the pulmonary trunk here. So we're looking at the anterior surface of the heart. My finger's going out through the pulmonary trunk. Okay? Does everyone see that? So it moved from the right ventricle into the pulmonary trunk. It's going to go out. The blood's going to get into the lungs. It's going to pick up oxygen. And then where's it going to flow from there? Back into the heart via the what? What vessels?
Vessels.
The pulmonary veins are going to take it back into what chamber? Left atrium. Okay, so let me put my heart back together again. To see the pulmonary veins and to see the left atrium, you sort of got to flip the heart around on its posterior surface. Okay, this big hole here represents where the pulmonary veins would have been. Okay, there's usually 4 pulmonary veins. When they cut this sheet part out, they basically took a chop straight across, so you can't see the individual little branches. So that represents the opening from where the pulmonary veins have been cut off. So my finger now is inside of the left atrium. Okay? Now let me flip it over again. All right. again, here is our posterior surface. My finger's now up inside the left atrium, and as I go downward, I'm passing through, what's this valve? That's the mitral valve, not the tricuspid. It's the mitral valve, also known as the bicuspid valve, also known as the left atrioventricular valve.
Oh, let's
Okay.
put it in mitral.
Your finger then winds up in this big space here, which is what?
Left ventricle.
Left ventricle. Okay? So up here, superior to this valve would be your left atrium. As you pass through the mitral valve, you're now inside the left ventricle. The left ventricle then pumps the blood up through the aortic valve, which you can just, you got to use your imagination here, folks, but right here, these very fine tufts, those represent the semilunar valves of the aortic valve. Okay? Anyway, the blood's getting pushed up through, out of the right ventricle, excuse me, out of the left ventricle, up through the aortic valve, and then into the aorta. Okay, and that's what's represented up here. The other part of it has been chopped off, and it's on the anterior portion, but you can still picture it. That's the aorta going up. The big part here where my finger goes is the arch of the aorta as it continues. This little branch here that's coming off, that would represent the brachiocephalic artery, also known as the innominate artery. Okay. All right. Now let me go to the cow heart. Now that we've done the little guy, we move on to this. Wham! I'm going to have to back up for this one.